I think before Dr. Mueller loses his power, we're going to get going.
I think I'm good. I don't hear any thunder or rain right now, so I think we're good.
Okay. All right. Well, we'll hold you to that then. So welcome, everybody. This is the 14th session of the 2024 version of our twice monthly series of virtual Wednesday roundtables. With these, we hope to bring you the latest information on both clinical and non-clinical issues important to the equine veterinarian. I think this is quite an important topic that we have this evening. This roundtable is entitled The Ethics of Emergency Coverage. Our panelist experts for this are Drs. Liz Arbatier, who will be our moderator, Barb Crabb, Bibi Freer, Eric Mueller, and Jim Zelliff. And once we get started, I'll let them introduce themselves a little bit further. First, one more reminder of housekeeping. I'll make this one quick. Questions go in Q&A, chat goes in chat. And make sure with chat that you have the to line pulled down so it says everyone. Quick reminder that these sessions don't convey race-accredited CE. And a shout out to Kevin Hinchman, our IT man behind the Care Credit curtain. But before we start our session, it's important to thank our sponsor for this session, Care Credit. And we're going to give sponsor representative Autumn Miller a few moments to speak. And then Autumn, when you're finished, if you'd pass over the virtual mic to Dr. Arbatier, please. So Autumn, you're up.
Sounds good. Thanks, Karen. So on behalf of everyone at Care Credit, thank you for your dedication to your profession, to your continuing education, but most importantly, the horse. As Karen said, this wonderful panel is going to be talking about the ethics of emergency coverage. Emergency situations are not only challenging due to their immediacy and the unpredictability, but there's also, ethical questions that they raise while balancing the well-being of the horse, the owner's financial ability, and your duty to provide care. We at Care Credit are committed to supporting the equine industry by providing financial solutions that help make necessary care more accessible, as often emergencies come with unexpected costs and a lot of tough decisions. We strive to ensure that veterinarians and horse owners have access to the resources they need while allowing timely, necessary care without the added pressure of financial constraints. We hope that all of your ethical decisions remain focused on providing the best care possible. But thank you for having me on tonight. I'll leave my information in the chat. If any of...
Oh no.
Oh no, Autumn just locked up. Well, we'll get her information and stick it in the chat for her, and maybe she'll come back. I think she's in a hotel room too, so who knows. Dr. Arbatier, I'll go ahead and pass things over to you.
Sounds good. Thank you, Karen. And as always, Karen, thank you so much. Oh, Autumn, you are back. Would you like to finish?
Oh, it didn't work. Oh, no.
You were frozen there for a minute.
Oh.
We heard most of it, just
okay.
The part where you were starting to talk about putting your information in the chat.
Oh, okay. All right, great. All right, yeah, I'll put it in the chat and over to Dr. Arbatier.
Autumn, thanks so much. And thanks to Care Credit for sponsoring this. Thanks to Karen, who is our fearless leader for every roundtable. So grateful to her for her expertise, making everyone feel so comfortable. Well, hi, everyone, and welcome. We are also excited to be here tonight to discuss the important topic of the ethical considerations of emergency coverage in equine practice. We're going to be approaching tonight in a case-based discussion format, and a bunch of our cases are going to start one place and then build from there. One thing we're going to be trying to do is focus on the ethics and not necessarily dig too deep into the solutions, although certainly part of dealing with ethical conundrums is to seek solutions. So some talk of solutions is definitely fair game. This is a whole webinar of gray area and discussion, and I'm thrilled with the amount of people who are here because I think we can really get some good discussion going. It's paired, as ethical challenges usually are, with a lot of strong feelings. There are regional differences in how we all practice, I think, that are extreme. And some aspects of ethical discussions are actually legal issues that vary depending on your state practice act. I'm really honored to be part of this panel of incredible practitioners tonight. So we're going to start with going around and having everybody introduce themselves briefly. I'm Liz Arbatier. I've been a general practitioner for 23 years, and I practice at the New Bolton Center in their ambulatory equine division. Barb, over to you.
I'm Barb Crabb, and I was the owner of a general equine practice with 2 associates. I spent 7 years on my own, and then 2 associates for the last 23 years until I sold my practice in January of 2023. I have a special interest in ethics, and at the end of my practice time, I did do a master's degree in ethics at the Neiswanger Institute, and I'm currently enrolled in a doctoral program. So I'm kind of very ethics focused in my future professional life.
We are very grateful to have your expertise here tonight. Jim.
Hi, Jim Zelliff from Pittsburgh, Pennsylvania. I'm with Allegheny Equine. We're a 9-doctor practice that does basically general equine practice, and we see a lot of emergencies for both our practice as well as some of the surrounding solo and 2-doctor practices.
Terrific. Bibi?
Hi, since my graduation from veterinary school in '88, I've ranged from working for large and mixed animal practices with large animal referral surgeries, and then came here as a solo practitioner. That grew into a large mixed animal practice with boarded surgeons for equine, and then back to solo, and then turned that into a multi-doctor ambulatory, which I recently retired from at the end of 23. So it's been a big mix-up.
Congratulations on your retirement.
Thanks.
And Eric.
Yeah, Eric Mueller from Athens, Georgia, and I was at the University of Georgia for about 34 years, anywhere from intern all the way through to a boarded surgeon. Had 24/7 emergency practice where we used to do emergency every other night to now where we have actually 3 boarded criticalists seeing emergencies as well. So we do emergency 24/7.
Great. So we're going to get started with our cases. I'd encourage you all to use the chat. Put your feelings in the chat. I'm going to read a case, and then we're going to discuss it among the panelists here. And then we'd love to incorporate your thoughts and discuss them as well. So hopefully your fingers are ready for some typing. All right. You're just done your day, and it's actually only 5 p.m. You might actually get home and see your family and grab some dinner. You're driving home, and you drive past a horse who's been hit on the road. Do you stop to provide care? Bibi.
I say yes. I mean, that was my life. Yes. Or at least stop to check and make sure somebody's coming. I mean, yes.
Barb?
Absolutely. Yep. That case for me is what I would consider sort of a paradigm case that represents what we have. That's our duty to provide care, would be to stop and take care of that horse in that situation.
Terrific. Jim?
Yeah, fortunately, that's a very rare occurrence, but absolutely, we would expect anybody who's not to just drive on by and let the animal suffer.
Thank you. And Eric?
Yeah, absolutely as well. Unfortunately, I've been involved with a couple of those where, there's been a car accident and you're in the traffic zone. And yeah, so definitely stop and evaluate the case, try to stabilize it with what you have, and wait till you get proper veterinary care there.
Great. And so far in the chat, we have people absolutely start care. Everybody seems to be coming to a consensus that yes, they would stop and provide care. All right. Let's say you actually get home and you're sitting down to dinner and you get a call about a horse that's been hit on the road about 30 minutes away. They're calling every vet's number that they can find. Do you go? Eric.
Are they a regular client or not a client? Yeah, again, 30 minutes away, probably try to assess the situation, how serious the horse is and what conditions he's in. Again, at a tertiary referral facility, I mean, our motto has always been, you know, whether you go, you know, you always offer to go or have the horse come in. Now that might be different if I was sitting at dinner with my family. You know, I would grumble, I would swear, I would say I'm not going, and I'd probably go. That's just me. And I would say I would charge the heck out of them, and this is and I'd get there and I probably wouldn't. So I'm terrible. I'm not a great example.
Okay.
Gosh.
And Jim.
And once again, right, this is a tough one. And what my biggest concern would be that I drop everything and rush out there and end up with a traffic jam of veterinarians who all responded, right? So I think my first question would be, you know, get an assessment of what this communication has brought, and is someone on their way, and certainly if I am going to load up and go, call the others and wave them off, because we have had this happen. I mean, not hit by car, like once again, Eric, I don't know how you've seen them twice. I've never seen a hit by car, but
You're in the South.
yeah.
I have.
But there's been plenty of times where you show up and a barn panicked on a colic, right, and called 3 vets, and we all roll in there, and it gets sticky, and so I would certainly hope that someone is furthered the communication.
Yeah, I have found in this situation, we'll say that, you know, they're just calling everyone. They don't know who's on their way. They're just calling and begging everyone to come, which is definitely sometimes how it goes. BB.
Yeah, I'm with you and Jim. I would reach out to my colleagues or find out from the people calling, who have they called, and is somebody already on their way, so that we're not all showing up. And from Eric's point of view, if I'm the one that ends up going, I've always told my mentees, charge them till you smile, because you're gonna lose less clients by being really nice and professional and helping the horse. And so what if you charged a lot, but if you're, you know what, and you're terrible, I mean, you know, you're mean, then that's not a practice builder. So if I end up being the one that's the last, everybody else said no, and I'm the one that ends up, then it's going to cost. I mean, it just is. But I'll go. I'm going to go if I'm one.
And Barb, and then we have a follow-up we'll use in the chat.
I don't necessarily have anything to add to that. I would go. My answer would mirror Eric's. I might grumble, but I would go. And once I got there, I would be fine. I think one of the questions that I saw pass by in the chat was am I on call?
Right. So
call.
If you are on call, and what if you're not on call? What if you're not on call?
So for me, if I'm not on call, I'm going to try to help the person by coordinating with the person who is on call. And that's assuming then that I have someone set up to be on call for situations. So I wouldn't necessarily go, but I would try to help them ensure that they got care elsewhere.
But there's an interesting question here, is if the owner's not there, who's going to consent to treat?
Right. So there's a question from Sarah, how would you charge legally treat if the owner is not the one calling or present to authorize care? Jim?
Find the owner. I mean, I think we've got a little Good Samaritan thing going here, right? Like if the horse is bleeding out or has a fracture, we're going to do our best to get it stabilized. But it's a tough position when you don't know what the owner's looking for.
Mm-hmm.
And one thing I should say is that we're lucky to have Barb here, an expert, but we are going to be referring a little bit to the AVMA principles of veterinary medical ethics and PVME A4A. Barb, that's one that you had. I think that's one that you had.
No, I'm that much memorized.
When physically presented with an animal affected by a condition that involves extreme pain or suffering and or poses an immediate risk to the animal's life as determined by a veterinarian, the veterinarian has an ethical responsibility to provide care for that animal. The difference here is you're not physically presented with it, right? You're sitting at home. And so that is where a little bit of an ethical conundrum lies.
Right, absolutely. The physically presented with an animal, actually in the development of those, the PVME, that was a big kind of bone of contention. And at the end of the day, I think that covers the one that you drive by, which everyone universally said, yes, we would go to.
Yeah.
Because you're physically, the animal's there, it walks into your room or whatever. You have to do something to relieve its suffering. But if you're not on call and you get a call, I think you have an ethical responsibility to help at least figure it out, make sure that animal gets care, but you don't necessarily have to jump and run. I know just with the mention of legally, can we care? I think something for all of us to keep in mind is that there's very much a separation between what's legal and what's ethical. So just because it's legal doesn't mean it's ethical, and just because it's ethical doesn't mean it's legal. So we have to remember that sometimes we put ourselves at risk making the at legal risk making the ethical decision.
Yeah, I think that's a really terrific point. So let's say same evening, rewind a little bit. You get home, you're just sitting down for dinner. This one is going to sound familiar to probably pretty much all of us. You get a call for a non-client horse who's having a terrible colic. It's all beat up. Its eyes are swollen closed. They just found it. It can't get up. It's been going on for hours in all likelihood. The horse sounds like it's in a really bad way. Do you go? Eric?
Yeah, this is a tough one. So the veterinarian me says you go, and I think it depends on what your policy is. What your policy is towards you. My whole motto is you got to be fair and consistent. So I try not to treat anybody differently. And if we had a policy where and this is probably another ethical question, if we had a policy where we don't provide emergency for non-clients, in that instance, I might not go. But again, what I would try to do is find and help them in any way possible to get a veterinarian or their veterinarian out to that situation. And again, if all of that failed, depending on how far that horse is away from me, I might go. It sounds like it's a bad deal.
Yeah.
It sounds like or I would strongly suggest they find a trailer and they refer it. Get it somewhere quick.
Jim?
Yeah, so this is something that we at Allegheny, we have a large number of people on call, and we do need to be consistent, like Eric said earlier. So our first responsibility is to our clients, and then we don't go more than 40 miles from our base. So if they're within 40 miles of our base and we have all of our clients taken care of, then we would go. But for the most part, we would try to get this horse on trailer and brought into our clinic so that we can take care of it there.
BB.
I just saw somebody make a comment that they had that happen, and it was, I hope I'm repeating this correctly, it was someone who had switched to veterinarians, owed them money, I think in a case like that, we did take the oath to take care of the animal. So if it ended up that I couldn't find the current veterinarian to go, I took an oath, I'm going to go take care of the horse, but I'm going to charge him a lot of money and hopefully get it. But yeah, this would be a difficult case in the scenario that someone wrote in the chat, that they already owe you money and they switched veterinarians and now the horse is in bad shape. But what do you do? I mean, to let the horse suffer? I think in my history, I've probably been there and I probably went.
Liz, I think this is a great place to bring up the cost to the veterinarian if we just say we aren't going to go, how do we, what is that? How do we feel about that, knowing that we left that horse to suffer without having anyone to take care of it? And I think that is what the moral distress question that I know you've done a lot of work on. And that is an equal problem for veterinarians trying to balance that.
Yeah, and I think that on the flip side of that coin, you can say, well, what about my mental health and my burnout and all of these things, where you can get those calls every single night, you know,
right.
You're in the right place. And so how do you balance your ethical responsibilities to a suffering animal with knowing that you only have so many personal resources? Let's see.
And just to follow up with BB, you know, when we do works out that they're within 40 miles and we are caught up with our regular clients, there is a hefty emergency fee, because that goes a long way to help that veterinarian's fatigue.
Yes.
And in our practice, they get 100% of the emergency fee.
And
so
that's the way mine was too. The veterinarians got 100% of their emergency fee. Yeah.
Make it big enough that it makes a difference to the person that's having their night ruined by running out for non-client.
Yeah, it certainly does.
Because I will tell you, from a business-wise, there's no better way to build your practice than to see non-client emergencies. But we had our personal experience with our practices. We lost 2 excellent veterinarians because they just got burned out with all the emergency work, because we were, you know, that post-COVID couple of years were tough.
Yeah, and the topic of moral distress is an interesting one. So moral distress, the actual definition of moral distress is knowing what the right thing to do is, but being prevented from doing the right thing. And so in these cases, you could actually choose to do what you consider the right thing would be, but at what cost, right? So there's a comment in the chat that says, after 30 plus years as a solo practitioner, these calls are emotionally close to devastating for me. And, you know, some other things. So for people in our audience, does a hefty emergency fee help? Does that help mitigate some of the burnout? Does it keep you going?
I see somebody says no, somebody says sometimes.
3 no's. Yep. No.
Sometimes.
Insure payment is huge though, right? Like, you can charge whatever you want. If they don't pay, it doesn't matter.
Right. Not to your family. Yep. If I'm paid at the time of service, it can soften the blow. Yep. No. Yeah, it's really challenging. And here, you know, I think this one case really gets to the heart of the emergency problem that we need to solve in our industry. And so.
Now, if this horse can get on a trailer, there's options, right? And this is something Liz and I go back and forth with all the time.
Yeah.
Is that it is night and day treating a horse, even in a small hauling facility where you don't have to drive. You've got all your equipment, you've got a stable environment, and you have help. It's just so much easier to get this done.
Yeah. So discussing the haul-in option I'll ask our panelists, but I'm also going to ask our audience, if you had the option for people to haul into you, does that soften the blow of seeing these kind of emergencies? Eric?
Yeah, I don't know about softening the blow, but you know, I think it's really important that that again, this is a non-client, but for our clients, you know, one of the first things that I tell them, even if they don't have a trailer, is they need to know where to get a trailer. And be prepared for these situations, because, you know, like I said, I mean, this is a bad horse. He's beaten up. He probably has a ischemic lesion, may need surgery. You know, that one of the first questions, and again, that we have to ask is, are you willing, you know, how far are you willing to go with this horse as far as treatment? Because you don't unnecessarily want to take a suffering horse and travel him 3 hours or he may not make it in the trailer. So again, for me, you can talk about getting a big bill and charging the heck out of them, but like you said, I don't think it does anything for the moral question of, do you let this horse suffer versus getting him in? And that's where I strongly think that we're going to have to go to having these clients prepared to bring these horses places, because as many people commented here, I mean, there's just fewer and fewer veterinarians covering more emergencies. And so, yeah, it doesn't soften the blow, but I do think it gives them options, and some of the responsibility has to be on that horse owner.
Yeah, and I think if we take the dire nature of this particular call out of it, let's say it's just an emergency, and you've got a bunch of emergencies. The haul-in option is definitely something that people are starting to make more available. More people are having areas that they can have people haul into. And so, Barb, do you think that makes it easier to provide emergency care to people that we might not be able to go out and see?
The haul-in option, absolutely. When it's available. I'm looking at the chat though, and I can certainly relate to this from my years in practice. And a lot of those people can't haul. The horses can't haul. They just can't. It's just not an option. And yeah, it should be, but the reality is it isn't.
All right.
But really, when you think it's a fairly small number, when you really look at your day-to-day emergencies that can't haul. Right. And obviously you have to be ready for that down horse, or just the horse that just doesn't get in a trailer. Right.
Jim, I think that's a super good just point in general. Compared the total number of emergency calls that we get compared to the true really have to be seen right then emergencies. If we could just figure out a way to take control of that a little bit, it would lessen the load so much, because it's not just whether they can haul or not, it's whether they really need to be seen or not. And we all know that a lot of the people that call emergencies, they're not really emergencies. I mean, this horse we're talking about obviously is, but.
And the big emergency fee helps that.
Yes.
Rethink how big an emergency is.
Yes.
And the other thing is, one thing that our profession needs to do better with is utilization of technicians. If you've got a tech at your clinic that can take a look at that eye and know that it's okay in a trail install for a couple hours, right? Or a laceration to clean it up and put a wrap on it till you get there, and then you can come in and bang out a bunch in a row, I think is a really nice solution for us in the future. Now, obviously, a very small percentage of practices have a facility, so we have to keep that in mind. But I think we did a client engagement survey last year, and I think it was, what was it, Eric, like 65 or 70% of the respondents saw the future of equine veterinary emergency care being university or regional practice acting as like a hub.
It's a pretty high number.
Yeah, for emergency coverage.
Did you guys see in the chat the for-profit equine ambulance in our area?
Yeah, so maybe that's another solution that that's another really interesting solution. I think a lot of people know haulers, right? Like at New Bolton Center, we have a list of people who can haul, but again, getting those people to an emergency at the right time, depending on how spread out your area is, it can be really challenging.
And just following from Jim, in my experience from having multiple types of practices, the more I educated my clients in how to recognize what's an emergency with an eye. One of my ophthalmology friends taught me that the eyelashes pointing down means it's an emergency. I was like, why didn't you teach us that in vet school? But anyway, I would educate my clients in what is an emergency and what is not. And in over 35 years, I got less of those non-emergency phone calls because they knew what to do. And I don't know, it pays you back to educate.
To follow up on that, we have a local practitioner and we cover her emergencies for her, solo practitioner, and she gets no emergencies. Like, she's got her people be so well trained that when they call, it's bad. And we don't get all those little ones because over the years she's just taught them to don't bother us if it's A, B, or C. Just count on D.
And I think the days of the entitled client are really going out the window. You know, like when they call and you say, this really is an emergency, they say, well, I want you to come out here anyway because, you know, I'm worried. I think that's going out the window, and I think people are recognizing that. But this actually brings us into our next case, pretty interesting. There are some really good comments in the chat too. So we're talking about this wave of the future, which is training clients to ship in for real emergencies when the horse can ship. Another trend is practices that are providing primary care, but no emergency service overnight. So it's general practitioners who say that from 8 to 9 p.m. until 6 a.m., emergencies need to ship elsewhere. We know that most emergencies can wait, but certainly not all. So those are the ones usually that need our help the most. So my first question is, what are the ethics of providing general practice without providing any emergency care overnight? BB.
I know I'm an old fart, but I really feel like that is unethical. I mean, that you're not available for those horses that cannot be shipped, just to turn off your phone at, I don't understand that at all. But I'm willing to hear other people's opinions, but.
Eric?
Yeah, I mean, I think you see a lot more of that, right? People go into, and I'm not picking on anybody here, but people will go into either a specialty lameness practice or a dental practice where they're going to primarily focus on those cases where they'll have less emergency. I mean, I know of a surgical facility in Ocala that doesn't do, won't do colic surgery, right? They do everything else during the day, but won't do colic surgery. And I was interesting on one of the chats, I saw somebody in one of the states that the State Practice Act says you don't have to see emergencies. I can't remember which one that was. So
This is general practice. So these are general practitioners, not specialty practice.
Yeah. So I think, again, I think there has to be a communication between your clients and they need to know, and everybody has to be treated the same and consistently. So is it ethical? I think if there's a life or death situation, I mean, I think you need to treat that horse. But I guess I would say, you treat it at night, then you're not going to treat the horse during the day because you're wiped out and we're not going to have enough veterinarians. So there has to be a balance somewhere. I don't know that it's an easy question. But I understand what BB's saying. On the flip side of that, I think, you got to do what's the best for the most. And that might mean not seeing one case at night so you can see 10 during the day.
That's an interesting, I like that phrase. Interesting. Barb.
Yeah, well, so Eric, the utilitarian argument for emergency care, which is kind of, one of my things, I guess, is if we don't solve this problem, utilitarianism says that you have to do what benefits the most people or the most beings or whatever. If we don't solve this problem and we don't have any veterinarians left, then that's going to be worse for the horses than.
Good point.
Right? So that's on the one hand, but on the other hand, we do have a duty to provide care, and our profession has a duty to society to be available for emergencies on some level. And then I go down a rabbit hole of this is just an insolvable problem, which isn't very helpful. But that's the struggle right there.
Yeah, I think it's upon us to try to come up with the best solution possible, whether that's a co-op, whether that's sharing. I mean, I think the flat out to have a single practice that says we're just not going to do emergency and we're not going to help is not by any means the right thing to do.
No. That's where it does become an industry problem, right? This is a problem that we need to solve as a profession.
Well, I do. And I just look at Jim, I just don't know, until we get things, I don't know we'll ever get things where they need to be. But I do think having having clients trained to have somewhat of an ability to haul a horse somewhere, and they all say they can't do it, but to train that, I just think you can treat a lot more horses with fewer people. And in the meantime, we're gonna have to go to at least a hybrid model.
Jim, what are your thoughts
Yeah,
when we take this case another direction?
Yeah, so first of all, there's a couple things like we say, well, you have to, right? But because we're getting into the, what's our morals and ethics versus what's our legal responsibility. And unfortunately, every state practice act is different, where they would spell out what you're obligated to do as a holder of a veterinary license, right? So to back up to the ethics, I think you need guidance, especially with group practices. And, ours is if we vaccinate that horse, or for non-vaccinators, we do a physical exam once a year, we have given those people a pledge and an obligation that we will handle their emergencies. And I would really struggle with turning off the phones and not being available. So the push on that is the emergency co-ops are a really good solution. I know they're successful in a lot of places. There's other places where they aren't. But a group get into a bigger practice and get more people sharing emergencies, because I'd really struggle with that. And then I know we have another case, but then they're hunting when they have an emergency to all these other practices. And that's putting us all in a tougher situation as far as the mental health of our people and compassion fatigue.
We've had some comments. One was on co-ops, which when I first moved here in Tryon, we didn't rotate emergency, but we covered for each other. If we left town or were sick or whatever, we would cover for each other. And then in the 2000s, I had colleagues that we rotated emergency. We were all solo and we would rotate emergency. And then another comment, and that worked out well, the co-op did. Another comment that came up while we were talking said, would you support like an emergency only practice that covered? And I would say yes, if you were in an area that could support something like that. But I know one of our questions was a person that was a solo practice that was in some desolate area with no other equine practitioners. I think the only option for them would be to cover all emergency you possibly can, educate your clients like Jim and I have been talking about, and hiring relief veterinarians to give you some total time off. I don't know, just
yeah. And one question is the public going to support practices like this, right? Are people going to self-select for practices that truly don't provide any emergency coverage overnight for the worst possible case scenario? So I know the AAP has had a committee looking at emergency solutions. Certainly a lot of them have been mentioned here with co-ops, between educating your clients so they recognize what truly is an emergency, forming co-ops when possible. Certainly we have a lot of colleagues who are the only vet in their area, and so things become really challenging for them, BB, like you were just saying. And then, one thing we have talked about a little bit are triaging services who can potentially triage cases for you and work with the practice to have a veterinarian take the call and triage it. And I know we have so comment in the chat about that. And there is a participant here who uses a service like that. So that's another possible option for the future. But this is the wave of the future. These practices are coming online, and it will make things worse for the people who are willing to go while other vets.
Because the reality, and I mean, not like you at Penn, Liz, but we see a lot of people come through. I don't think anybody goes into equine practice thinking they're never going to do emergency work. And some of them think it's really cool, but you can only put up with a certain amount and before it disrupts your life. And that's really what we're we're trying to work out here. I think no emergencies whatsoever, just turning your back on your clients, is tough.
Yeah, and the other people in the comments saying triaging services amazing. Definitely can be part of this wave of the future to save our industry. Okay, I'll be very interested to hear what our participants think about that. Let's say you get paged for a dystocia for a non-client, but you give them a huge quote, they say no problem, they give you a credit card, you run their credit card, you're fine, and you're driving there. And as you're driving on the road, you realize it's taking you into a really desolate area without a lot of people around. You're by yourself, you don't have a tech, and you're starting to feel pretty unsafe because you're in an area you're not familiar with, and it is really, really desolate. What are your choices ethically if you start feeling unsafe? Barb.
Yeah, I mean, this is a tough one. And again, in the development of the update of the PVME, this was a pretty strong conversation that no one should feel ethically responsible to do something that they fear for their personal safety. And I think that's one of those situations where I think we've all been there, where we kind of might have to draw that line.
Yeah, Jim.
Totally agree with Barb. And we don't ask a whole lot of questions. If someone feels unsafe, turn that truck around. And we'll call the client and say, haul it into the clinic. We'll make sure there's plenty of people there when they show up. Or just, sorry, we can't do it.
Eric?
Yeah. I think it depends on the situation, the area, and but if they're at all afraid for their safety, I mean, I don't think you can make them go. But I think that's something they, hopefully they would have known that area before they took the credit card and recommended that somebody else went. And that doesn't always happen. But, unless you're totally new practitioner to the practice and don't know the areas. In our practice, there are definitely some areas that are less safe than others. And we usually just tell interns not to take those calls and don't go there and make sure they find somebody else.
Yeah, I think if you're in a real rural area, especially if you're one of only vets out there, vets who have to drive, a couple hours to get to emergencies, you might not know where you're going to land.
Yeah.
Phoebe.
I agree. I mean, I don't think there's any excuse for putting ourselves or our associates at personal risk. I mean, if you're not feeling safe, then we just can't go. I mean, yeah, and I feel like I'm pretty dangerously brave, but there have been nights where I didn't feel like this is not good.
Yeah.
Have any practitioners in the audience ever canceled going to emergency because they didn't feel safe? Definitely have some people saying they recognize what a hard decision this would be. And
I'm not saying it would be an easy decision. I'm just saying you can't expect somebody to put their health or life or what, at risk if they're afraid.
Yeah. I mean, we're always told to follow our gut, right? If our gut feels unsafe in a situation, we should probably listen to that. But having the ethical dilemma of, an animal that's probably going to die, potentially you could call around and find solutions, right? Like, I think everybody would probably try and do that, but
I don't think, maybe this is not politically correct, but I don't think wimps become equine veterinarians.
Yeah,
Whether you're a guy or a girl, I don't think you doctor on horses if you're, I think if you're feeling afraid, you need to take care of yourself.
And they need to know, especially in a group practice, right, that it is your individual feelings and how you feel, not worry about getting any blowback the next day or something like that. I mean, we have ladies that have weapons in their trucks, and I mean, fine. whatever, right? And I'm sure the further west you go, the more people are gonna have a little helper underneath their seat, right? And you know how to use it. But for the most part, it like we've been saying a couple times, if the person's uncomfortable, turn the truck around.
Turn it around. Yeah, I agree.
I think the chat is great, and there's a comment about having 2 trucks en route to a dystocia, like calling for backup. And I'm thinking, BB, I'm listening to you say, you're not a wimp. I'm not a wimp either. And I've been to those where I have been absolutely terrified and come through a lot, down in the bottom of a creek bed with a bunch of drunk cowboys and, a horse, and I'm by myself with my trusty Jack Russell, Yeah. And in hindsight, gosh, how stupid was I? But I think getting back up, trying to find help, trying to do what you can to try to help them is a good answer to that.
And like somebody says in the chat, this job isn't worth it, guys.
No. Yeah, that was a scary story if you saw that go by.
Yeah.
It just isn't.
All right. You're paged by one of your regular clients who has used you for many years. You have a great relationship with them, but they admit that they had another vet in their barn who traveled from another state to evaluate their performance horses and perform therapeutics. One horse was injected 3 days ago and is now swollen, febrile, and extremely lame. How do you react? What do you do? And what's the ethics of follow-up for these kind of cases? Jim.
Yeah, like that one's brutal, right? Like you got to take care of the horse. And this vet is probably 3 states over, and there's no way they're going to come and treat the horse and charge them till you feel better about it and get it in. And I wouldn't do a quick flush on the farm. I would get it to the clinic or refer it to Eric and get this thing fixed and whatever it costs. I mean, we all have our opinions about people that are traveling around doing this work, but there's a lot of it. And I would hope that veterinarian that is coming from out of state to do this therapeutic work is comfortable to stand up and call the local vet. And the flip side is the local vet comfortable and not be mad that they're not doing the work, but the two of them communicate, right? Like, here's my notes. I saw this in this horse. I did this. This is what I injected with on this date. So at least there's some continuing care and it can get taken care of appropriately.
Are you calling the vet if you head over to see this emergency?
Absolutely. Most definitely.
Eric, how about you?
Oh, yeah, I've had this situation. I can't tell you how many times. And there's always somebody who's going to come and treat a horse. Either the horses are training down here in the South and they're from up north, and their veterinarian will come and see 30 horses, polo horses, standard breds. And, you treat the horse, you try to educate the owner, and then make sure you call that veterinarian and let them know, the horse had a reaction or infection. In this case, it probably is, and hope that they'll learn from that. But it's especially if it's my client. I mean, I usually take care of them for other things, but they do have some veterinarians, that they prefer to do certain aspects of their work. So,
what if it happens multiple times?
Again, in my situation, I try to educate the veterinarians, but you have to be firm but diplomatic, and then let them know what they're doing wrong. I'm not one who's afraid to tell somebody that they've done something incorrectly, or maybe I'll review their technique or their product and try to educate that veterinarian. So that's it just happens a lot. Luckily, with good communication, they can usually get the idea. Some don't, but yeah, try to educate them as best you can.
Barb, how about you?
I guess I agree with all of that. I would take care of the horse, absolutely. I do wonder in that scenario, if there were to be a question of a board complaint for a lack of follow-up, where I would stand on supporting that if the client were to get angry.
Yeah, and it's interesting because a lot of these, again, this is just world according to Mueller, but a lot of these veterinarians can have some pretty tremendous mistakes, and the clients are just so infatuated with them, they don't see it, no matter how much you try to educate them. And again, ethically, you don't want to be bad mouthing any, unless it's really malpractice, then you bring it up. But if it's a joint flare or an infection that can occur, try to look at the techniques. But most of the clients are, it's amazing to me that they'll get really mad at the referral practice, but the one who caused the first problem is golden.
Yeah. I mean, if it's a repeated episodes, I think that's a different question than not being available for follow-up. They're two different things.
Right, I see, yeah.
Yeah, but also, I don't know, one of my regrets, honestly, in practice, and I think we're all very reluctant to turn colleagues into the board or our state boards for problems that we see. And sometimes I think that's an ethical problem that we should be more willing to do that if we have repeated problems.
Yeah.
And BB.
I would, I think in that question, it was how would you relate to the client, and then how would you talk to the veterinarian who did the injections? And with my client, I would do the best I could for immediate care. Like Jim, I would refer the horse to Eric, or, for treating the infected joint or whatever. And I would charge them appropriately. I would also, I work with a lot of farriers, and we do monthly meetings where we shoe horses. I always require that if the regular veterinarian is not part of our group, I always require to get their name and phone number and call them first. And so my point of that is, if somebody's coming in from out of town and doing a bunch of lameness and injecting joints in my patients, then I would ask them respectfully to please include me in that info. I don't mind that they're there and doing the work, but could you give me the records? Could I put that in my patients' records? And I would just respectfully ask them to include me in whatever they're doing.
I think that's a great point. And there's an interesting comment in the chat about, do clients need to only have one veterinarian in the barn? And the case, sort of the example in the chat is that one vet doesn't want to do lameness, so they have another vet who's great with lameness coming in. And the situation I'm kind of hypothesizing is what is more common, at least in the region where I am, which is their vet would be doing that work, but they're kind of using a different vet. A lot of times in the horse show world, it's, the vet du jour, and, someone has horses jumping a lot of clean rounds and everybody wants whatever's going in those horses' joints. And so I think everybody here kind of talking about collaboration between practitioners and then, being willing to see those emergencies. I think that makes a lot of sense. Okay. This one also probably a lot of you will be able to relate to. Let's say you're in an area with a lot of horses and a lot of horse vets. You are busy and you are tired. You get a call from a non-client, a very nice non-client, who says their vet is away and told them to call you. Now that vet did not run this by you before they left town. You call the vet's number, and sure enough, on their voicemail, they give you as an emergency contact. This client sounds like a terrific owner who does everything for their horse, and they're extremely upset that there seems to be some misunderstanding. How do you handle the client, and how do you handle the vet? Jim?
So this is something we see, and if the vet is somebody who you work with on a regular basis, that you do cover for them, they just forgot to let you know, then we just go as we have before. And we tell the client, well, there's some communication mix-up. We're here to take care of your horse. What can we do for you? If it's habitual and someone doesn't call, because usually what we do is we have that person reciprocates for us in one way or another, helping us when we need a little backup, right?
Let's say
So-
this is not someone who just forgot to ask you. This is someone who never asked you and doesn't ask you.
Never ask, doesn't ask. We're not necessarily, if we see each other, we're not going to stop and chat.
Potentially.
Then honestly, I see that as a business opportunity for my practice. And I tell them, we're here for you. And we will take care of your emergency. It's too bad your vet isn't. And then I would call the vet and say, please don't put me on your machine without letting me know. Because they're still going to get treated as a non-client for us, which means it may not be seen if our clients are keeping us busy.
I am in total agreement with Jim. I think we have run our practices very similarly. There would be a larger emergency fee, and I would respectfully ask my colleague, please don't put me on unless you call me and ask me first. I mean, but I wouldn't say I won't do it, but just please let me know when I'm on duty for you. And that's happened to me in the past.
Yeah, I mean, this used to happen to us regularly, and everything Jim said, yeah.
Yeah, I would agree as well. I guess I'm curious if people do charge non-regular clients higher fees than regular clients as a fair and consistent practice. I mean, is that like some memberships charge members less than non-members? Is that something people do?
And that's actually the way it looks on our bill, is the emergency fee is discounted for clients.
See, that's interesting. So people go ahead and put in the chat, that's a great kind of outreach marketing thing, right? So it's not that you're charging necessarily more for non-clients, it's that your regular clients are getting a discount. I think that feels really good to people, so go ahead and put in the chat what you guys do in your practices. Here's someone with a non-client emergency fee, someone who should charge non-clients more.
But never do.
But doesn't. Someone who habitually has this happen from one particular vet. I have been the recipient of one vet like that and makes me really angry. What is a client and how is that defined for everyone? I think the most common definition is someone you see at least once a year where you can, have a VCPR, put your hands on the animal, do some wellness work.
We actually had a range. So we had a non-client emergency fee, depending on how long it had been, if we'd never seen the person versus if we hadn't seen them in 5 years versus if we'd seen them within the year. And we had a sliding scale for our emergency fees based on that. And when we implemented that, for me, it made a huge difference in how I felt about going to see those non-client emergencies because it was big enough to make me happy.
Did everyone weigh in on that one? I lost track of what was going on. Okay.
Yeah, you're good.
Okay. All right. Here's a slightly different topic. Let's say that a practice owner who owns an ambulatory practice is told by multiple reliable clients that one of the veterinarians who works for the practice is aware of someone behaving abusively towards horses. And in addition to not reporting this, the associate has treated wounds induced by the abuser. Has anyone run into that situation? And what's the responsibility of the practice owner once this information has come to their attention? And again, this is from lay people reporting. Bibi?
I think this is I think there's a responsibility of the veterinarian that's treating the injured horses and the responsibility of the practice owner who just became aware. If they know that it's true, if it's provable, then they're ethically and legally responsible for reporting this.
Eric?
Yeah, I agree 100%. The problem often arises that it's, in your aspect, it's hearsay. So you don't know for sure. You don't know the facts. If you have documented multiple witnesses for sure. But and I think it's important to make people aware. You know, in those instances, if I don't have all the facts, I might go right to the depending how well I know the person and say, hey, you know, listen, some people are concerned that something like this, and try to nip it right in the bud, right where it is. But if you have the facts, it's evidence, then I think you have to report it. But it's a tricky deal if you don't.
So is it your responsibility to investigate it, or is it your responsibility to just report a concern?
That's a really good question. I think it's certainly not your, it's not ideal to totally ignore it. So, and when you say investigate it, I mean, I wouldn't go on a Nancy Drew mystery or anything like that, but, which I'm dating myself probably. But I do think, you know, or I would encourage the people that reported it to me to kind of follow it up.
Jim?
Yeah, I mean, you know, that's tough. First of all, it's not up to us to investigate it, right? It's up to us to decide whether or not to turn it over to the people who do investigate it. And like Eric, if this was a regular client, I would want to look them in the eye and say, what are you doing here? But if it's not, I think we have animal control people, and we turn it over to them.
Barb?
Yeah, no, I agree. And I think the part of this that maybe we've missed so far is that we're the practice owner. So our first step is going to be to talk to the associate who's been treating the animal potentially for those injuries, right? And find out what their opinion is. But I agree. I don't think we're necessarily responsible for investigating, but I do think we have an ethical duty to report.
Yeah, and our fearless leader, Kathy Anderson, says there are state regulations that mandate reporting of suspect cases. With increased social media scrutiny and USEF regulations regarding care and custody, we are all expected to respond ethically. Advice from animal control. If you are wondering whether to report it, report and let them determine if there's a problem. So the burden is not on you to investigate it, but if you have concerns that you think are valid, to report.
But I kind of agree with that. I mean, that sounds, you know, that it's your responsibility, at least bring it to somebody's attention who can investigate.
All right.
Just a little thing from my part on the compensation committee. We really can't, there's some going on the sidebar. We can't have a discussion about what we charge for things in this.
Well, right.
Okay, so if you guys want to go back and forth, that's really not appropriate for someone to say what their emergency fee is.
Yeah, we just got a comment from somebody I know well. That's
we all know well.
Yeah. Federal government has some things about that, about us talking about prices.
Okay,
no
prices in this.
This is another ethical conversation.
Yeah.
All right. Let's say you get an emergency call from one of your regular clients who just got a new young horse that you haven't met yet. They call because he was totally freaked out in his paddock, tried to jump out, but he's a dressage horse. Now he has a terrible laceration on a distal limb. It looks like the joint is involved and it's a big laceration. You love surgery. Let's say you love surgery, you love repairing things, and you think this looks like fun. You approach the horse, who reacts really violently towards you. The client then admits to you that the horse is way less handled than they thought it would be and is in fact pretty much feral. It doesn't lead, and it's not just scared, it's really watching where you are, and it has good aim. You find out that to get it to that farm, they basically created a chute and they ran it onto the trailer. You can't even get an IM shot into this creature. So without coming up with all the solutions of what to give it orally and things like that, what are your options when the horse is a really bad actor and you physically don't feel safe? Barb?
I mean, I think this is very much the same situation, that we don't really have an ethical responsibility in that when we don't feel safe. And this actually, I will never forget this in practice with exactly this scenario. And I did happen to have a technician who could handle anything with me at the time. And it was like a turning point for me. I watched her try to go into the stall with this horse with a giant gaping laceration, and the horse tried to kill her. And I remember my brain saying, this is not our problem. We don't have to deal with this. And we did hand the client a tube of Dorm gel and walked away and came back and got it taken care of. I mean, I think trying to find a solution, obviously, but we don't have to get hurt. And I've been hurt badly. I don't care to, nobody should have to get hurt.
Jim?
Yeah, and I mean, this is obviously an extreme case, but we just have a bad horse, right? And it's not our job to train the horse. We walk away, and if a tube of Dorm gel and come back an hour later will do it. But as we probably know, not getting into that rabbit hole, but once that horse is that excited, I don't know if anything's going to work. And I'd love to put it back in that chute and shove it back on the trailer and send it to Eric.
Yeah. And they do. And they do.
Eric, what are your thoughts?
No, I agree 100%. I mean, there, it's, again, if a horse is a danger to itself or to a person, I mean, it is absolutely not worth being injured, and if you're not, it's like I tell my kids, if you're not comfortable doing something, don't do it, because you will get hurt. Or if you think, I said, if you think you shouldn't do it, don't. I mean, and that's the case here. And even when we get those horses, I mean, some of those horses will be darted. I had a horse that was in a pasture that when you went in the pasture, it would charge you like a rabid dog. And we had to dart that with a gun to anesthetize it. And actually, eventually, the owners put that horse to sleep because it was a danger to everybody. So yeah, you definitely, you explain, as somebody said in the chat there, you explain why you're going to do that. And this happens with joint injections, We've had horses we've had to anesthetize to inject their hocks because they aim at your head. So you explain if there's a way to take care of it, yes, but otherwise you say no.
Yeah, and there's an interesting comment in the chat that I love. Before I leave for any emergency, I ask about the horse's training level. Can you halter and lead the horse at a bare minimum? So I think that's terrific. And Phoebe, what are your thoughts?
Well, when you said, what are your options? My first thought was, I'm luckier than most people because one of our veterinarians in my area, she tells people that she'll work on anything with hair on its tail. and she has a dart gun. And so when I've ended up with horses like that, I call her. I just tell the client, call Beverly Hargis. She can shoot your horse with a dart gun and get it done. And so I had an option that most people don't have, but I think the other option, other than calling Beverly, is saying, no, I'm not risking my life. That's not where we are.
That seems to be the consensus on the chat too. So it's not really up to any of us to put our lives on the line. And yes, for sure, even well-trained horses can be dangerous, no question. You can get hurt working on a nice horse. Why kill yourself working on a really dangerous one? And here's a great comment. Our food animal colleagues are better at this than we are. They will not go out if there are not working facilities. We should take a lesson. Okay. You all can continue to submit your questions. And here is a question from one of the participants. How do you handle backlash from your clients as you narrow down your ambulatory emergency radius? In the early days, our practice would go 90 miles in any direction, and now we limit to 40 miles. We let clients know verbally and on every invoice, but they're still upset when we won't come and we ask them to haul in. Jim.
Yeah.
We actually have a document because, and now if it's a non-client, it's tough, but for any clients that we may do some work for that's outside of that 40 miles, the trainer and the owner both sign a document and it clearly states that we do not provide emergency coverage to that area, because these people get wild, and they get wild on that young associate who's trying to tell them no, and we just have paper and we'll read back or show them, you know, a digital copy of what they signed and say, you knew you'd get a trailer when you signed this, you got to get the horse there.
Barb?
Just one more thing. If it's a non-client, we just tell them clearly. Our first priority is for our regular clients, and we cannot be, because, you know, 40 miles is 80 miles, right? We can't be more than 40 miles away and provide proper service for the people that really care, you know, trust us and have us take care of the horses.
Barb?
Yeah, I mean, I think that scenario is easier for the new clients, and that's a great idea, Jim, that you just establish at the outset that this is outside of our radius, and we don't do that. When we get people from barns, when we used to get people from barns that wanted us to provide care that were outside of our normal radius, we always told them up front that they needed to establish a relationship with a veterinarian in their area to do some of their regular care, like their vaccines or whatever, because they were going to have that relationship in place in order to get emergency care, because we couldn't come that far. But I think, Liz, part of what your question was changing the rules, or right? Like, you used to go there, but now you don't anymore. And I think that's a little bit harder once clients have started depending on you, and then you change you shrink yourself down. I think how you handle that is a little bit, I would have a harder time turning away a client of 20 years that we used to go to, and now we've changed our rules and we don't anymore. And I would probably bend my rules for some of those people.
Good
Kind
comment.
of like fired type thing.
Good comment in the chat saying backlash is battled with education ahead of time. You're prioritizing your team's work-life balance, especially new grads who are maybe more sensitive to such abuse. 100% they are. They need the support of the seasoned folks to get reassurance that it's okay to limit services in such a scenario. Bibi?
In my 30 whatever years here, I've never gone over 40 miles, and so I guess I haven't reached that problem because I limited in the very beginning, so I don't think I can add.
Eric, what about limiting your mileage once you recognize it's too big?
Yeah, it's as they said. I mean, I think it's one thing that you won't have to phase in if you've already had a policy. It has to be well advertised on every invoice, for a good period of time. And again, you have to be consistent. You can't make exceptions. As soon as you make an exception, somebody's going to find out about it, and they will guilt you. They will try to guilt you into doing that. But I think, and then the other thing is again, if you can, now this is going to be difficult, but if you can find them an alternative that's closer, and which is often not the case, and say, listen, this person could provide the services, and maybe call that veterinarian and explain what's going on. They may or may not want to see him, but I think it's education, and even then, it's like a planning meeting. They're going to probably ignore it until they need it, and then they're going to complain about it, and then you just have to be firm.
Yeah, for sure. And great comment in the chat. Before I commit to providing general care for clients outside of my typical range, I let them know ahead of time that I don't provide emergency care to their area, which I think this is key for people who work in more rural areas. If they're comfortable with that, I make sure they have access to a trailer to get to a referral hospital if needed. So that be part of your thing. You must have a trailer to get somewhere. This person says they should probably get that in writing, though. Probably so. But again, then you have those few cases of those horses down suffering overnight. What do you do for those guys? Which kind of brings us back to the first question we started with this evening.
Yeah, I think it's not only important that they have a trailer, but that they've had the horse know how to trailer. Because many times they have a trailer and the horse won't get in the trailer. And then, it's a colic, and before you know it, it's 4 hours and the bowel's dead. So I think I try to tell my clients not only have access to a trailer, but make sure your horse will get in a trailer.
And have your trailer be inspected, lights that work.
Little details. All right, this is going to be our last question, and this is a question sent in tonight, and it was also one we got in preparing for this webinar. What are your opinions, and searching for input from everybody, what are your opinions and suggestions for a rural one-person general equine practice to be able to handle meeting the legal requirements for emergency care without burning out very quickly, being on call 24/7? So this person is by themselves where they live. Barb?
Yeah. I think that's a tough situation. I did think with this person in particular that the vet triage option might be something that could help them a lot. Although the reality with that is that they're still on the hook 7 days a week. I mean, the vet triage would minimize the number of days that you, or the number of calls that you got, but it wouldn't necessarily limit the days. Sorry. I think this is where, again, I just sometimes feel like this is an insolvable problem, because I personally wouldn't be able to just say I'm not going to do any emergencies 3 days a week, but 24/7 is not sustainable for anyone. So I think you need to get big enough that you hire an associate, which I think is what all of us did who started out solo and then went to 2 and went to 3, is I can't take it anymore. I need somebody to help with emergencies.
Yeah, and maybe you get creative about figuring out how to support 2 people to share emergencies, and maybe there is something creative there that can be done, outside of whatever you normally picture general practice as. Jim?
So part of this question is, legal. They using the word legal, and that is, we discussed earlier, that's state by state, and that's a hard question to answer. But the concept of, even though they seem to be in the middle of nowhere somewhere, whether it's 2, 3, 6 hours, there is a referral facility. So you do what you can do and let them know that on the days that you're not available, they got to load that thing up. Or like everybody else said, hire an associate, right? But
good luck with that, right?
If it's truly rural enough that there's not enough horses to support 2 vets, it's not happening.
And maybe you train a small animal person in the area, like maybe there's a small animal person who would be willing to, pass a tube on something occasionally. BB?
Yeah, well, in my early days here, I mean, I did have 2 other associates that were equine, but we didn't have a co-op, but we covered when we were sick or out of town. But also, just relief. I mean, in my early days when I had my baby, relief veterinarians, at least I know that doesn't give you a relief like weekly, but at least, you could go on a trip or take a vacation if you hire a relief veterinarian. And also back to where Jim and I were talking earlier about client education, just communicating with your clients so that I think the vet triage is a great service, but also just educating your clients in what's a emergency today and what can wait till Monday is a huge, triage. So anyway.
But this is a big deal. This is nationwide. These people,
Yeah.
There's plenty of people that are stuck in this situation.
100%. Eric?
Yeah. I mean, I think, education's huge, whether it's a vet triage or just a picture or video on your phone, because, you get the horse that's supposedly, non-weight bearing lame, and you get there and the horse is walking down the aisle just fine. I think, communication, education, I'd be interested to find out, how they are contacted. Do they have a service? I'm not a good example because every veterinarian in the Southeast has my cell number, but a lot of veterinarians, they give out their cell number and they're accessible. And as old as I am, as somebody said, you have to establish some boundaries and deter it on whether it be an answering service, whether it be an answering machine, to put a level in there to minimize some of the calls that you get. I don't know how people feel about that. What your emergency fee is on the answering service may deter some people from emergency today till something they can deal with in the morning.
And that's a really super good question, though. Like this access with the phone. You know, if that's your only way of having them contact you is to can't call your cell phone, and they might be calling to schedule a Coggins test for tomorrow, but it's still waking you up and getting you going.
Right.
What you know, how's that work, and how do you other ladies do that? I mean, do you leave your phone, you turn it off, do you only use it when you're on call?
I mean, our pager came through our cell phones. That was how our pager worked after giving up on answering services. But honestly, if there's one thing that I could change, that I would go back and change now, I would have had 2 phones, because even when I wasn't on call, I knew when those pages came through, because it came through to all the doctors in the practice, and I knew there was an emergency. And if I just didn't know about it, I think that would have helped my work-life balance problems, probably.
Yeah, I think we're getting a mix of, vet triage, answering service, office phone, and education.
Great. Well, I think this has been really great discussion tonight. I'm going to hand this back to Karen. Thank you, all of you. Thank you to our participants for being such an engaged audience and giving us some great information. Really appreciated all the engagement and great thoughts. Karen?
Thank you, Dr. Arbatier. Thank you to all of our panelists. And yeah, attendees, wow, great job. Lots of really good comments. We very much appreciate it. I didn't expect us to be able to solve all the problems of the world during this panel, and these are tough problems, but certainly heard some good ideas, and if nothing else, you kind of know we're all in the same boat.
Mm-hmm.
So, and AAEP is doing what it can to help keep that boat afloat. So, yes, thank you so much to Drs. Liz Arbatier, Barb Crabb, B.B. Freer, Eric Mueller, and Jim Zelliff. And thank you to Autumn Miller and Care Credit for sponsoring this session. Thank you to Kevin Hinchman for hiding behind the Care Credit logo and giving us any IT help, which we didn't need once again. Glad Dr. Mueller kept his power on the whole time. So, that always happens right before a webinar. But yeah, thank you, everyone. Remember that this will be available on demand as well. Oh, and I always tell everyone that if you have a question for the panelists that you didn't get answered tonight, I'll give you about a week to send that question to me, and I'll pass it along to our panel. I just stuck my email address in chat. I don't make them liable for answering questions forever and ever, but for the next week, if you have something you want to send along, send that to me and I'll get it to them, and then we'll try to get something back to you. So thank you one more time. Yeah, and I think we'll go ahead and let everybody go. One last chance to wave goodbye, and then we will see you later. Oh, good.
Okay,
I like those little applause hands that run through. Thanks,
Thank you.
everybody. I'm going to hang up.